Good afternoon, everybody. Pleasure to have you all here. How's everyone doing? Everyone having a good day so far? Awesome. Well, I am thrilled to be joined by two amazing people from Montage Health. My name is Suzanne Katz. I'm part of our solutions team here at Notable, and I have had the pleasure of working with many folks on the Montage Health team. And I have to say, it's just been incredible working with them. I spent my career prior to joining Notable actually working within large healthcare systems and hospitals. And I was always priding myself on being part of that care team and really having a huge impact. And I think working with Montage has been incredible because they surely let me know that I am part of their care team whenever I'm talking and meeting with their team. They want to create that value. They want to make sure that we're meeting the highest standards and they want to move fast. And I think you'll see today as we talk through some of the different initiatives that they've worked on and as they go through streamlining different processes, just how much they've accomplished in a very short period of time. And I'm also thrilled and excited to hear what's coming next. So, very, very much to talk about. So, thank you both for joining us. I want to introduce both of our speakers and then hand it off to them to share everything that they have accomplished so far. So, first, we have Meg Dingy. Meg is the director of digital health at Montage Health in Monterey, California. So, not too far. In her current role, Meg is responsible for leveraging innovative technologies to improve the patient experience by simplifying system navigation, creating more self-service options, and automating internal standard workflows so that providers can spend more time with patients in front of them and less behind those computers. Meg has worked nearly 20 years in leadership, has experience in healthcare strategy planning, execution, hospital quality and performance improvement, and community-based population health. So extensive experience. We're also joined by Dr. Stephen Packer. Dr. Packer has served as president and chief executive officer of Montage Health and its related corporation since January of 1999. Prior to this appointment, Dr. Packer served as chief of staff at Community Hospital of Monterey Peninsula and was also the medical director of Community Hospital's intensive care unit for 11 years. A graduate of UCSF School of Medicine, he's also completed internal medicine training there and followed by pulmonology and critical care fellowship, followed at UC Irvine. Thank you both so much for joining us, and I'll hand it off to share a little bit more about Montage Health.
Well, this is a nice small group. It's a pleasure for us to be with you. And as Suzanne said, it's just a short jog up the road. It was probably one of the nicest commutes I've ever had. Just drove up Highway 1 through Santa Cruz and up to Half Moon Bay. It takes about 90 minutes or about 90 minutes down the coast. Our organization is located in Monterey Peninsula, on the Monterey Peninsula in Monterey, California. Our service area, we serve, our primary service area is about 160, 170,000 people. The county of Monterey, which really the rest of the county encompasses our secondary service area, we're about 450,000, 500,000. So it's not a large metropolitan area like some of the areas that some of you work in. Our delivery system is the only delivery system in Western Monterey County. So we serve a broad and diverse population that ranges from ag workers and actually commercial fishermen to a large retired population, a surprisingly large group of a collection of higher education exists in Monterey County. We have in Monterey we have the Defense Language Institute, the Naval Postgraduate School, the Middlebury Institute for International Studies. So it's a pretty diverse community. Our system, you're going to hear things that are pretty similar to what you heard from North Kansas City as well. Our system started as a single hospital. We've been in our community since 1934 as a small community hospital that has grown over time. Over time, we moved outside the four walls of our hospital to develop as private practice failed, particularly in primary care. We got into the business of owning and operating primary care practice and now multi-specialty practice we employ we're just a little short of 100 physicians who work at Montage Medical Group in 14 different specialties. We have a total of 450 plus physicians on our staff, about 3,000 employees across the enterprise, 55 to 60,000 ED visits a year, and well over 250,000 outpatient encounters through rehab services, PT lab, lots of imaging, and the like. So again, a vertically integrated system that has enjoyed, I think, the comfort of being the only system in our area, and that's been both a blessing and a curse, right? When you're the only system, you sometimes get really comfortable with what it is you provide, and you realize over time, and I'll spend some time talking about that in the next slide, that that geographic isolation only goes so far, that you really obviously need to continue to up your game and continue to enhance services that you provide, because people clearly have options. This gives you a bit of a sense of our org chart flipped on its side. We operate urgent care centers. We co-own we started and co-own a large, we co-own a provider-owned health plan that provides both a Medicare Advantage plan, and we have plan-to-plan relationships with several large commercial insurers to manage the health of their insured populations in our community, as well as providing insurance coverage and care management for a number of large self-insured employers as well in our community. So about 1 in 6 Monterey County residents are managed through Aspire Health. As I mentioned, the medical group, the hospital, and we've launched a few years ago and are now opening a campus in child and adolescent mental health that's known as Ohana, and that particular enterprise saw a little over 20,000 patient encounters last year, with a clinical staff of about 60 child and adolescent behavioral health providers of various disciplines and training. As we looked at a digital partner, we had a number of strategic priorities, and obviously these are going to sound a little bit redundant or familiar in the sense that many of you, I think, have had similar challenges and had similar goals. Delivering value-based care, we are starting to see the incursion of some large statewide or national integrated delivery systems moving into Santa Cruz County in the form of Kaiser and the like. And we obviously want to be sure that we can compete. We have a number of value-based contracts, Primary Care First, our Medicare Advantage plan. We have a number of lives at risk, so we want to ensure that we are always doing things like capturing care gaps and enhancing the care in our value-based population. We think it's every time access is an issue, getting into a primary care doctor, every time there's a missed appointment, an appointment that is not booked, given how constrained our provider population is, that's a missed opportunity because there are people waiting to be seen. So we thought it was extremely important for us to find a solution that would allow us to expand access to the patients who are waiting for care, and ensuring that they are retained as well. And reducing our administrative burden, I think all of us struggle with hiring and retaining enough front desk staff, front office staff. Our highest turnover rate in our clinics hasn't been with our medical assistants or with our physicians, but it's that front office staff. It's historically, those are the staff that they come in at some of the lowest hourly rates, and we're competing with non-healthcare job opportunities as well. So during the pandemic, we were seeing 20-30% annual turnover in front desk. It's very, very hard to generate a consistent customer service experience when that front desk personnel is new and is not necessarily seasoned and trained in how we want to interact with staff. And when we look at our Press Ganey scores, what we found is often the battle was won and lost before the patient even saw the provider. It was, what was that front desk interaction? What was that registration like? What was the appointing like? Getting the call back, getting the appointment scheduled. So for us, it's all that front end activity that needs to take place before the patient sees the provider that is important. What we find is our providers get great Press Ganey scores, but often patients are so dissatisfied by the time they actually are face to face with the providers. They're already at a disadvantage. It could be a losing game. And then finally, improving financial performance. And by that we mean clearly the cost of personnel in a very, very high cost of living area. Every time we need to hire people to do what could be work that could be automated, it has a significant drag on our margin. In California, 51% of hospitals in California are operating at a negative margin, and 70% of hospitals are either at a negative margin or at an unsustainable margin. So, that speaks to a reimbursement from our Medicaid plan, Medi-Cal in California being really inadequate. Speaks to, in our market, a very high government payer mix in general. We have 21% of our payers are commercial payers, and 78 to 79% are government payers. So it's a challenging financial environment. So we're always looking for ways that we can leverage technology to reduce our administrative expenses. So as we were looking at different digital engagement strategies, this really describes what we were looking for. And what we had seen generally in technology, we had one EHR, we have one instance of Epic across our clinics and our hospital. But when it comes to the health plan, there are any number of bespoke solutions that we put into place for managing chronic diseases or for following patients, our care managers and the like, and different solutions in our medical group and still different solutions at the hospital. What appealed to us about Notable from the get-go is this was going to be a platform that we could utilize across our enterprise for solutions that would address issues at the health plan, issues in our value-based contracts in our medical group, whether it's primary care first or MA contracts, and when it came to scheduling and pre-registration, could address that with hospital-based outpatient services, so physical therapy, imaging, infusion, or any of our medical group appointments and the like. So it was really looking for one seamless, single solution where a team could work and address, sort of be in Meg and her team of two, work with literally all of our internal customers to help them identify and address solutions that can be automated. And so what we're going to hear about next is a number of solutions, areas where we've been able to leverage Notable's technology to be able to address some significant problems in our organization.
Thank you, Dr. Packer. Yeah, so I'll jump into how we're using Notable today, and I'll just mention I've been with Montage Health for about 2.5 years, so I actually moved to Monterey, California from Colorado for this role. And one of the things I think the organization really saw the need to prioritize an investment in digital health, because of course we all know pandemic was, I think, had a huge impact on how consumers and how our patients and community members expected to engage with their healthcare systems. And also when I first got to Montage Health, you saw all the different entities that we have. Well, each entity was doing its own thing with appointment reminders, or how they, there was a little bit of e-check-in going on, but not everywhere, but just in some places. So I think for appointment reminders alone, we had 4 different solutions. 2 of them were in the hospital. So different departments were doing their own thing as well. And with that came a really disparate patient experience. And I think in my first 3 months, there was as everybody familiar with, it's not Nextdoor, the neighborhood app. You guys know that one? So I think in my first 3 months, it was kind of nice because there was this terrible Nextdoor rant that about, 100 people hopped on, saying that their experience, there's no way to, schedule an appointment without making a phone call, and then they have to fill out this paperwork, and then they have to fill it out again. So it was kind of nice. I swear I didn't plant it, but it really helped me to get the support from the executive team to partner with Notable. We were just starting those conversations. And I think
the good news is thankfully Nextdoor has now moved on to Lost Pets. That's pretty much the only.
Oh, and Macy's, the Monterey Macy's, terrible. Yeah, don't shop there. But Yeah, so in my conversations with Notable, we had a lot we wanted to do, and Notable really seemed to be the partner that could do more of it. And we wanted a long-term partner, just not a short-term point solution, but somebody that we could grow with and partner with over time to solve more of our problems. So the first thing that we implemented was registration and intake. I would almost say that's really just table stakes at this point. It had to be done. It laid the foundation for the rest of our partnership. But where I really get excited, and I'll talk about it a little bit more, is the population health stuff, because like we can directly see how we're changing people's lives and improving the health of our community there. And then the referral stuff is really cool too, because of how we're just taking these horrible mundane tasks away from people and letting them do the jobs that they love, which is like really being in front of the patients in front of them. Let's see, keep going. Yeah, so I think you can see this timeline here. I mean, we started our partnership, I think we contracted like in November of 21, and we were off and running by January of 2022 with our intake and registration solution. And we've done a ton in a pretty short period of time. One of the things that I think was really successful is we iterated. So we would take like the primary care practice, right, and go live with registration and intake for them, and then see how that was going, iterate, make improvements, then go live with another department, then go live with the hospital. So, I mean, over the course, a whole year it took to get from, I guess, through the entire project, but we were iterating all the time, and like we waited for payments sort of towards the end. So now we're completely live across our entire enterprise with this module, and we're starting to work on the clinical intake aspects of it now. We do have some clinical forms that are live and going really well, and we're excited to keep expanding there. So you'll see there's also a lot of things I think that might not even be on here. If they are, I'm not seeing them, but some of the problems that we've had that have popped up along the way, like the beginning or like middle of 2022, COVID was still here, and our ED team was, calling patients. So physicians, infection prevention staff were actually calling all patients who left the ED to tell them what their COVID test result was, and then give them the information that they were required to give on how to manage that result. And so that was extremely time consuming, definitely, trying to track down patients, getting voicemails, leaving voicemails, getting the patient calling back. So we contacted Notable. I think it was Martin Luther King weekend. It was a long weekend, and there wasn't going to be any staff to call the patients on Monday. And so this was a Friday at like 2:00. And within 2 hours, we stood up this automation with Notable on COVID results that lasted for, thank God we don't need it anymore. So we think we just dismantled it recently, but it saved so much time. And so those were the types of things that we've been able to do. Like, so in addition to these the care gaps and the referral automation, but some of these like small workflows that really have had a huge impact on our organization. We're also using Notable to deliver a lot of our MyChart tickler messages, if you guys are familiar with that from Epic. So, activation for MyChart or pay, bill pay, all of those things, we're delivering those through Notable today and seeing really good results.
The one of the things that I noticed here, Meg, we hadn't planned to mention, but expanding to Epic Connect partners. So we have a number of independent practices still in our community who have signed on to our instance through Epic Connect. And this wasn't something that we promised to them, but it certainly has become a value add for these small 1, 2, 3 person practices, for them to be able to use the appointment reminders and registration for their private practice patients as well. So it's been helpful.
Absolutely. One thing I'll mention too here, and Dr. Packer, I'm a team of 2. So Faith is the other better half of the team. But for about 18 months, it was just me. But really working with just not.
Are you going to whine about that stuff?
No. I'm just saying. But the reason I bring it up, and it wasn't just Notable, we had other digital health solutions too that I was working to implement. And what was really cool about this partnership is I felt like I had a team with Notable. So I had our HIT partners, and I certainly had our operational partners in the organization. So I'm not whining because I wasn't alone. And it was really cool to have Notable come in and provide like this incredible team that I would work with every day to roll out this stuff and actually do it pretty quickly, and really made me feel successful. So,
and to Meg's point, I mean, I think it's one of those, when we first started with the slide, there were probably about 50 to 60 items where we started with. So just to show you how quickly they move, how many different initiatives they have, it's really incredible with the speed with which you've moved across this and how many things have actually come to fruition.
All right, moving on. So first we're going to talk about what I'm most excited about really with anything that we're doing, which is our care. Sorry, because I know you love those referral automations.
I'd love to see what you all are doing.
Yeah.
Amazing impact.
Yes. So for our care gap automation, I think everyone's fairly familiar with what that is now, so I won't go through that. But we are now live with all 5 of the 5 care gaps that we targeted for this year. And so those are cervical cancer, colon cancer, diabetic eye exam, mammographies, and hypertension. Hypertension just went live last week, and now we're really exciting. And one thing is, you probably know this, but it's not just a one and done. So this care gap automation that goes through everything from scrubbing the chart of the patient to look for other for labs and other documents to show that that patient has actually received their pap smear or whatever elsewhere. And then if not, then they can actually outreach the patient, invite them to self-schedule, ask them information about whether or not they've had that care gap closed elsewhere. So it's really exciting stuff, and it's ongoing. So we're just now only starting to see the very beginning of the results. This is just an example for colon cancer screening, but I actually brought the numbers because I want to make sure I'm putting the people in front of you here. But for all of those care gaps that we've had live now, we're talking about more than 12,000 care gaps where charts have been scrubbed, and about 15% of the time, 5% of the time, we're actually able to close that care gap just from scrubbing the chart. And then 15% in total, we can close it from chart scrubbing, getting information from the patients, or getting them scheduled to come in. So these are actual human lives. Like, this is a lot. I love this project. We found with cervical cancer screening alone, we found over 100 patients who had high-risk HPV in their last lab who perhaps could have been lost to follow-up. And we're getting them to come back in to take the next steps in their care. So with this project, we really are improving the lives of the patients and in our community. And so that's why I get so excited when I talk about this.
Yeah, it's amazing to talk about because that is truly 15% that is fully automated end to end.
That's right.
So there's no human in the middle of that process, and now can continue working with those patients who need additional care. But incredible results just with that.
Yeah, and obviously, of course, the clinical results are incredible, and that's what I'm certainly focused on. But from a financial perspective too, this is helping our medical group actually meet their quality metrics. And it's staff capacity. There's no way our medical group had time to scrub the charts of 12,000 patients. So that was work that really wasn't even happening. And so just really exciting stuff. I guess I'll wait for questions.
If there are questions.
Any questions about the care gap work? Okay. All right, moving on. And then there's the provider satisfaction piece of it. So this is from one of our internal medicine providers at MMG, our medical group. And she is truly amazed that this is happening, that her care gaps are getting closed, and she isn't doing the work there. So just, from a staff and provider satisfaction perspective, it's huge. So the next strategic priority I'm going to talk about is expanding access and attracting and retaining patients. And I'm going to talk about 2 different projects. One is the intake and registration automation. And then the other is a solution that we have now live with our emergency department for their substance use navigator program. So I'll skip ahead and then I can talk about those in a little more detail. So this one is, where are we here? Okay, this is registration and intake. So I think, everybody knows what that is now. We weren't really doing it before. We were doing it to some capacity with e-check-in, but not really. We're at 53% for our engagement rate. So that means 53% of patients who walk through our door have already completed their digital registration, payments, and other information online. So you can imagine the impact that we're seeing. I mean, we're seeing huge check-in time reductions. We're collecting more revenue and money before patients walk in the door. So it's just been incredibly successful. And we're answering, the call from our patients of please let me be able to do this on my own.
Well, and they're happier, frankly, because if they're arriving at a busy clinic and they're anxious and they're having to stand in line to register, I mean, they just sit down and, I'm here, and they're brought back. I mean, it's done. And it's just streamlining that entire intake.
Yeah. And for people like me, working parents, I can do my intake a couple days before. I can do it at 2 a.m. if I want to. I don't have to, if I have to bring my kid into the doctor's appointment, I'm not sitting there having him grab my pen out of my hand and scribble on my paper. So it's just definitely a big satisfier. So from the patient perspective, again, we're answering them. They're excited that we're really investing in this digital experience. And then for our staff, this is from one of our operational leads at our medical group. There's just a different vibe. So you walk through the practice, nobody's standing in line. You don't have irritated, grumpy staff members. We've actually reduced our turnover rate with our staff at our medical group because of this project, and our Press Ganey scores for patient experience for really everything before they see the doctor they've gone up. So very valuable stuff here. Any questions about this one? All right. This is the emergency department substance use navigation project that I referenced. So we have 2 substance use navigators who are outreaching all of the patients who leave the ED with a substance use diagnosis. So a lot of opioid addiction and other issues. A lot of these patients are unhoused. And they're addicted, right? So they're really a very hard population to get a hold of and to nail down. And these 2 navigators, it was just one for a long time, spending all of their time just calling, texting, waiting for somebody to call back, trying to outreach the patient again, and really not getting a lot of results there. So what we've done is we've automated the whole process of outreach. So upon discharge in Epic, there's a trigger that sends the patient a text message, lets them know, we're here for you. We have these different resources. Are you interested in them? And then gets that. So about 16% of patients are responding to this text message. And then these ED SUNs, they call them, substance use navigators, are actually able to spend the time with those patients who have the readiness to receive the support that they need. So it's been hugely impactful. We've saved tons and tons and tons of hours of work. And again, can get the patients who are ready for care, the care that they need.
So again, these are patients who, when seen in the ED, often after an overdose, they are often started on Suboxone in the ED, though not always. But even if they're started, they're going to need follow-up. And so that's where our substance use navigators come in, and establishing a digital connection with these patients. They may not be housed, but everyone has a phone, and everyone, I think, welcomes that interaction. The numbers here aren't that large yet, 60 patients. But again, if you think about the mortality rate in this population, getting these patients treatment and support can reduce the mortality in a very, very high-risk population.
So this is from one of our substance use navigators. I mean, just saying like, gosh, this was so nice during this really busy month in August. And the reports that they get with all of the information to help them triage and prioritize patients are really easy to use. Let's see. And then the next one we're going to talk about is our referral automation and outreach solution. And I'm going to pass this over to Dr. Packer to talk a little bit about this program.
So we have about somewhere between 48 and 55% of kids under the age of 14 in Monterey County have obesity or are overweight. Again, we have a population, their diet is problematic, and so we developed a program called Healthy Together some years ago that we offer through our Aspire Health plan. You have to be an Aspire patient, but it's through our Pop Health kind of outreach. We offer this program to patients who are seen by pediatricians or family physicians, and it is a 6-visit module of where the kids and their parents learn about healthy eating. We assist with food insecurity, a variety of education about food and the impact of food. So it's a very, very successful program. But getting people scheduled for getting kids and families scheduled for this particular program has been historically problematic. Well over half of these families, Spanish is their primary language. So we developed an outreach now using Notable, where that is scheduled. These referrals take place automatically through Notable, and it's resulted in a much higher adoption rate and enrollment rate in our Healthy Together program. And it's been just a great program from us with proven outcomes.
Absolutely. Yeah. And here's those outcomes. So 20% of all of the referrals are actually scheduled by the patients themselves without staff intervention, which is key. But I think this was referenced by Pranay earlier. We had a 21-day time frame from when that referral came in to when we were usually able to schedule that appointment. It's down to like about 3.5 days. So that's really where that impact is, because if these patients and families, they leave the doctor's office, they get this referral, they're interested. 21 days later, they don't even know what this is anymore, and they're probably not going to be as engaged. So getting them right away has really resulted in a lot more patients getting the care that they need and getting scheduled into the program. And then 75% of these external referrals are processed without staff intervention. So there's still some that have to go back to staff because they're missing information or they're handwritten, but 75% is pretty good. And we had a person at Aspire Health who was spending an entire 8 hours a week just transcribing this, referral off the fax machine into Epic. And just imagine, like, that's not joy and work. So that particular person has been able to upgrade her job to actually spend time and working with the patient. So that's really exciting.
So the wake-up call from the pediatrician, you're in their office with the patient and their family. The wake-up call where the pediatrician says, "I'm really concerned about your weight and its long-term impact on your health." Again, the sooner you get scheduled and into the program, the more likely it is you're going to attend and that it's going to stick. There's a pretty significant attrition over a few weeks.
Definitely. And we're also live with primary care new appointments as well. We're sort of new with that, so we didn't put the outcomes here, but trending in the right direction for sure. And then we're really excited. We just got approval to move forward from the breast care center to look at bilateral screening mammographies and ultrasounds. And Faith might have to correct me here. I think we have like something ridiculous, like 100 per day that are coming in on a fax machine right now. Is that right? Just on paper fax alone. So we're going to make such an impact here. I will say from a change management perspective, it's been a little harder getting this department and some of our hospital departments on board with this because they're a little bit more complicated, right? The referrals are. So we picked some kind of not complicated visit types here with the bilateral screening mammographies and ultrasounds. And I think we've talked a lot about this. It's like, try it. We're going to try it. We've gotten them to say, yes, we'll try it. And then hopefully we'll quickly expand when they can see that the accuracy is really good. So moving on. So this is from a patient. Again, thank God for this new era of technology. Again, these patients, we have a lot of Medi-Cal patients, a lot of Hispanic patients as well. And to be able to have this convenience, they're working, sometimes both working parents, it's really, really important. And then from the Healthy Together program, I already said this particular staff member has much more joy in work now, working at top of scope, and we can focus and prioritize on the patients with that high level of readiness. So I think this is back to Dr. Packer to talk about the financial stuff.
Well, yeah, let's just stay here. I mean, because this is really it. I mean, obviously, capturing higher copays, a greater percentage of copays prior to clinic visit has been important. It probably isn't quite material in the scheme of an entire health system's finances, but it is amazing how much time and effort and energy you spend trying to chase those copays later on the back end, and that's problematic. Obviously, working we've worked really hard to try to share the successes that have occurred in one department with broader throughout the organization. That's your fifth pillar, is that right? Share success. Yes. Yeah, exactly. And again, finding a tool that works across the entire enterprise and that's flexible enough to really be able, with the team at Notable, for us to be able to say, this is the problem we're trying to solve today. How can we approach it? And so, having a flexible digital platform partner that allows us to, as new problems arise and new opportunities arise, just to be able to build on that same platform.
Yeah, and I'll just add to that. I mean, I think this communication piece is so important. How we've been successful is just really, I really try to stay in front of the organization, all different stakeholders, to present the outcomes. Don't do it as much as I want to, but I'm doing as much as I can. And this week, actually, Dr. Packer and I are presenting to the entire board of directors, board of trustees, also to share about this work because it really is exciting. And the more we share, the more there's a willingness to try new things.
Especially if we use the word AI when we're presenting.
Yeah.
Then they'll be particular.
Yeah, people aren't really scared of that people in our organization are, but our board is really excited about it. So, and then the other thing that I think somebody mentioned during this conference is, your digital strategy really is there to support your organizational strategy. And that's so important. They're not different. The digital strategy is really just enabling the priority areas of the organization. So, and then looking ahead, I think people are starting to get more and more excited. People are asking me, they're coming to me and saying, hey, do you think Notable can help with this problem? So we have a lot of different areas that we want to expand all the things we just talked about. We're also looking into some of the HCC suspecting work. We're looking at expanding what we're doing with the ED Navigator program for additional diagnoses as well to ensure that we're getting that follow-up for patients. And then just making sure that we are filling those spots because, as Dr. Pecker said, that's incredibly important to our patients and to our financial health.
And then obviously we heard earlier today about MIT Medical and their use of large language model digital assistant, and that's something we're looking at as well.
Yes, thank you.
Well, I want to thank you both so much for the time. It just goes to show how much amazing work you've both done. It's one of those where there's probably so much more we could have even talked about today, but thank you so much and continue to share stories across all different customers, but thank you. And we're excited to do more.
Thank you.
Thank you.
Thanks, everybody.
Thank you, everybody.